Hi, I'm Brett Stetka, Editorial Director at Medscape, and welcome to the F1000 Practice Changing Minute, where we report on commentaries from the faculty of 1000 on highly rated studies that may change clinical practice. Our F1000 commentary today covers the study Recommendations for Use of an Isoniazid Rifapentine Regimen with Direct Observation to Treat Latent Mycobacterium Tuberculosis Infection. The study is from J.A. Jarab and colleagues, published in Morbidity and Mortality Weekly report. The faculty of 1000 has given this a ranking of changes clinical practice and exceptional with a factor of 10. Our commentary on the study today was written by Dr. David Griffith. Dr. Griffith is a professor of medicine and the William A. and Elizabeth B. Moncrief Distinguished Professor in Comprehensive Heart and Lung Research at the University of Texas Health Center at Tyler. In his commentary, Dr. Griffith wrote, as outlined by the CDC here, the treatment regimens of choice for latent tuberculosis infection in otherwise healthy patients aged 12 years or older now include the 12-week, 12-dose isoniazid rifapentine regimen, as well as the traditional 9 months isoniazid regimen. Compared to the 9-month regimen, the significantly shorter duration of the 12-week regimen, the demonstrated improved patient adherence with this regimen, and comparable safety of the regimen will make the 12-week treatment regimen preferable for many, if not most, eligible patients with latent infection. This review and the CDC's guidance follows very closely on the heels of the publication of results from a multi-center trial of isoniazid and rifapentine for the treatment of latent TB by Sterling and colleagues. This manuscript offers guidance for clinicians about when and how to adopt the 12-week, 12-dose isoniazid rifapentine regimen for the treatment of latent infection. And the guidance from the CDC is pretty extraordinary in that the results of the recent published studies by Sterling and Martinson were so compelling that rather than wait for another cycle of ATS CDC-sponsored statements that guide the latent TB infection therapy and would likely be many months or years in the making, this new treatment regimen could and should be adopted by TB control programs for many, if not most, patients. The guidance from the CDC should be read in detail, and it is in its entirety by prescribing physicians. If it answers many, if not all, questions about the target patient population, the optimal administration of the regimen, and potential side effects of the regimen, as well as drug-to-drug interactions and monitoring of patients while on the treatment. And with that, this concludes today's commentary. From Dr. Griffith for the F1000 and Medscape, I'm Dr. Brett Stetka, and thank you for listening.